What is a filling?
Filling is a plug of material that we can replace the damaged tooth structure.
I have a hole and a fracture in my teeth. Are they both able to be filled?
Okay, well, if it's a really small, I haven't looked at your mouth as yet, but we need to take an X-ray also to look at the depth of the cavity. If it's only a small cavity or moderate cavity, yes, it easily can be fixed with the simple filling. However, if it's really large or the tooth is really damaged, we might have to consider more complex treatment. To start with the filling, we need to numb the area first. We put the numbing gel and then we numb you. We wait a little bit until you're quite numb, so you won't feel any sensitivity to hot and cold in here. And after that, we have to remove all the decay and wash and dry the tooth and pack the filling material inside the tooth and let it set with the light, which is a blue light normally, because we use the white filling material in here only. And after that, we shape it. We make sure that the bite is not high and is comfortable, and we floss in between to make sure that you can floss. You see that this is a cavity and that's the nerve in the middle. When it's just the beginning and before it gets to the nerve, it's very difficult to diagnose unless we take an X-ray to find out what's going on. If you are sensitive to hot and cold or sensitive when you are eating something sweet, it's better to be reviewed by the dentist just to make sure that there is no problem and there is no hidden cavity. There are many factors are involved that affect the longevity of the filling. If you grind your teeth or not. If you are a grinder, the filling lasts much less and they usually crack. Every time that you come for a checkup and clean, we check all the fillings. We make sure if there is any crack, if there is any leakage around the filling, we can let you know. And the good thing is that we've got a camera with 100 times magnification, so we can show you what we see in your mouth.
I really want to try and avoid having any more fillings in my mouth. How would I prevent that?
Well, with a good oral hygiene, good brushing, good flossing to clean between your teeth, and also a regular checkup that we do almost every 6 months, and a regular X-ray every 18 months, we can hopefully there's no cavity if you do everything, but if there is any early cavity, we can detect it. And also good diet, you know, avoid anything sugary. Obviously we have to be realistic. With the lifestyle we've got these days, we can't just say that don't cut everything out and don't eat anything sugary. But if we can cut down on that, it would be great. And the frequency of the time that the frequency is much more important to keep it minimum. The downside of the white filling material is it stains over the years, especially if it's a front tooth filling. Every few years we have to change it. I would say the main disadvantage of white filling is it shrinks up to 1% a year, and then you end up with gap between your tooth structure and the filling. So the longevity of the white filling is less than the silver filling because of that, and the very first things that you would notice most likely after the white feeling, it causes sensitivity. It causes sensitivity to hot and cold. So when you're drinking something, it feels very uncomfortable, and usually after a while it will settle down, but obviously that's a very prominent disadvantage in the beginning.